welcome to another edition of The Magnate. By now, you know that we feature cerebral people, achievers, excelling in different professions. And today will not be an exception. We've only been able to feature 1, 2 ladies on this program, even though we have several of them making a mark in different endeavor. We have somebody who, normally you will say somebody with caps with several feathers. But today we have a lady with a scarf with several feathers. That is to say that she's well endowed in different tasks. But she's here specifically on one task, on one of the several tasks she has to do. It's an Amazon. Not talking too much, we'll be focusing on, in fact, the month has been sort of declared as Colorectal Awareness Month. And that is the awareness we want to create on the program today for your own benefit. Let's give you a summarized version of her profile.
She is a professor of pathology with over 23 years experience in teaching and research, 25 years as a consultant pathologist, and 12 years as a professor at the University of Lagos and Lagos University Teaching Hospital. She obtained MBBCH in 1988 with a distinction in pathology and Best Student Prize in Pharmacology from the University of Calabar. After completing her residency postgraduate medical training, she had further training through fellowship and awards on diverse areas of her specialty, including 1-year fellowship sponsored by the International Society of Nephrology in Renal Pathology at the University of Alberta, Edmonton, Canada, in 1997 to 1998. UICC ICRETT Research Fellowship at the University of Leeds Teaching Hospital, United Kingdom in 2007. African Cancer Leaders Institute Training Award for an intensive leadership training in 2017. She is an accomplished academic with significant contribution to knowledge, having over 120 academic publications in local and international peer-reviewed journals, and has trained over 40 pathologists. She is involved with several international multi-center collaborative studies, including ARETA clinical trial on HER2 positive breast cancer, U54 NIH grant on epigenomic study of HIV-associated cancer, and she is the LUTH lead for African research for oncology, theme that is carrying out several studies on colorectal cancer. Professor Abdulkareem has diverse leadership experience, served both in public and private sector, including membership of visitation to panel to the Polytechnic Ibadan, Court of Governors of CMUL, 2 times head of Department of Anatomic and Molecular Pathology, chairperson of several standing committees in UNILAG and LUTH. She is the founder of Fajin Medicare Foundation, a foundation aimed at improving health status of the underserved communities in Nigeria. She is also the current chairperson, College of Nigerian Pathologists, Lagos State Chapter. She is amiable with strong passion for teaching community service, promoting healthy living, particularly regarding cancer control, at several public lectures, and in print and electronic media. Professor Fatimah, as she is fondly called, is happily married with 3 wonderful children.
You're welcome back. The program is still The Magnate. And like I said in the intro, this month is Colorectal Cancer Month. That is, create several awareness. My pleasure to welcome Professor Fatimah Biade Abdulkareem. You're welcome to The Magnate.
Thank you.
Thank you for coming to add value to this program, tapping from your wealth of knowledge.
Thank you for having me.
Colorectal Cancer Awareness Month. I mean, let's first of all start with the name. A lot of us may not even know what is colorectal. We hear of colon. So what's the relevance of colon to colorectal?
Colon and rectum, they are both part of the large intestine.
Okay.
You remember biology or science class, say stomach, small intestine, large intestine. Large intestine is that part where the feces stays after digestion, and that is in the rectum that the feces stays.
Okay.
Is the last part, the one that is next to the anus.
Okay.
So it's the large bowel. So just like we know that cancer can develop from any part of the body, so colorectal cancer is one of such cancer that arises from the wall of the large intestine, the colon through the rectum.
Why the sudden declaration of a particular month for colorectal? What's informing that?
Well, colorectal cancer awareness month is not just starting, but as there's more development and more knowledge, and then as we have more people, especially with colorectal, that used to be like number 5, number 4, is now number 3.
Wow.
Cancer, worldwide, and in Nigeria is like number 4 after breast, cervix, and prostate.
Okay.
So because it used to be low down on the list of common cancer, now it's coming up. So increasing number of cases. And then apart from that, we have younger people coming down with the cancer.
Okay.
And thirdly, because this cancer is one that when you have it, you hardly know until it's late,
Okay.
because the symptoms are non-specific.
We'll dwell more on the symptom later, but you are actually here as the principal investigator for ARGO. What's ARGO? I mean, it's an acronym for, tell us, what is ARGO?
African Research Group for
Okay.
Oncology.
Oncology, those are those
Oncology
that,
is
treat
about
cancer.
study of cancer.
I know a bit
Africa,
of that.
and then research.
Okay.
It's a research group that was formed by 2 gentlemen,
Okay.
Professor Segun Alatishe of OAU, Ife,
Okay.
and another colleague at the MSKCC in New York,
Okay.
Professor Peter Kingham. So they formed this. The group started, of course, initially as people coming together to learn more about how to manage cancer, particularly cancer of the breast, of the colon, and others. So later on, got a grant from NIH in the US, and several studies are being done.
Okay.
So we now decided to form a definite group whereby, in fact, we meet every year to discuss about this cancer, about new knowledge of how to manage, diagnose, and treat them.
I know you as a consultant pathologist. In fact, you are the Lagos State Chair of Pathology Association of Nigeria.
Yes, College of Nigerian Pathologists.
Okay. So what's the
Lagos
relevance
State.
of oncology, pathology? They are all GG anyway.
Yes.
So that you are
Of
heading
course,
this.
treating cancer or managing cancer generally is a multidisciplinary approach.
Yes.
So you have
Several
the physicians, you have the
specialists.
surgeons, you have the physicians will probably be the first person that the patient will come to present to. And they will say, I have this. We say, go and do some tests, and you see some signs. Okay, go to the surgeon. The surgeon will do other tests, and then probably do surgery. And then later on, when they do surgery, whatever is removed, it goes to the pathologist.
For analysis.
So the pathologist will make diagnosis, not just making diagnosis, but it's also going to tell them what type, at what stage, what is the grade, what is the severity, has it gone further, and then we'll also tell them about things that we call prognostic factors. There are some characteristics that you see in tumor and you say, oh, this is how this tumor is going to behave, and then something about what to use to treat the tumor. So the pathologist is involved in both diagnosis and management.
Okay.
And then you have the oncologist who will now eventually, after diagnosis, will manage the patient, to treat the patient with whether radiotherapy or with drug chemotherapy or immunotherapy now, because we talk of personalized treatment now. So they determine exactly what type of cancer you have and the type of drug that will be effective for your cancer. So what Mrs. A is using would different for Mr. B.
Okay. Now, earlier on, you gave us some statistics that is even getting to some younger age brackets. Now, is it more common from your analysis so far? I know you're just going to do some research. From your analysis so far, is it more common in male or female? You know?
It is more common in males than females. Okay. People above 40. In Nigeria, studies that we have done in Nigeria, a particular one where we reviewed all cases that have been diagnosed over 53 years, and we discovered that the mean age then was about 53 or so years. The proportion of people that are below 40 years that have this cancer in Nigeria is higher than when you compare to other developed countries.
We are still chatting with Professor Fatimah Abdulkareem. Let's go for this short break. We'll continue with this stimulating conversation and let us really know what all this research about and the strategy they want to adopt for this research. We'll be back shortly. You're welcome back. The program is still The Magnates, and I am conversing with an Amazon here, Professor Fatimah Abdulkareem, consultant pathologist, but more importantly, the principal investigator for the African Research for Oncology, LUTH branch. You're welcome again to the program.
Thank you very much.
Now, this research, you told me, you whispered to me that you want to recruit. What is this recruitment about, particularly for this month that we are having this colorectal awareness sensitization? First
of all, like I told you, that ARGO is a research body that consists of several specialists, and our concern is about carrying out research on cancer, on every aspect of cancer, from diagnosis to treatment, and also detection, which is screening. So one of our several research, because we are carrying out several research currently on colorectal cancer all over Nigeria.
Interesting.
And we do have ethical approval from the National Health Research and Ethics, and as well as that of College of Medicine and LUTH, because before you carry out any research, you must get approval for such research. So this particular one is about colorectal, and what we're doing this is we want to look at better ways of detecting it without using invasive. We say invasive, meaning something that is simple, that you don't have to use any instrument to enter into the body, neither any injection whatsoever. It's just a test of, there's a kit that you put the stool inside, and then, so this recruitment, we're going to be inviting people from 45 to 75 age, whether male or female.
In Lagos alone?
This one is in Lagos. They have done for Ife, they're going to do for Ilorin, but we are this upper way.
Investigator for
yes,
Lagos.
For
LUTH.
Lagos, for LUTH. So we're going to be asking people to come. So we're going to have to, first of all, determine whether they are eligible, and eligibility means that they do not have any risk of any risk factor, because we are looking for low-risk people who do not have family history of colon cancer, and who don't have symptoms and signs of colon cancer, and also who have not been diagnosed of colon cancer. Okay. So they will be given the kit to take home, and then the following day they will bring back the kit having put their stool inside. Then we read it. When we read it, if it is positive, if it is negative, then the person is free.
Clean bill of health.
Yeah. But if it is positive, it could be so many things, really, because the positivity rate from the pilot study that has been done is about 20%. So we want to recruit at least a minimum of 500. So we expect that 20% of those will be positive. So what do we do for those that are positive? We're also going to go ahead to do a test, which is called colonoscopy. Like we're going to introduce
an instrument.
an instrument through the anus to check through the entire large intestine and see if there is anything there. And whatever that is there will be removed. The pathologist will look at it and say whether it is cancer or not cancer. And then if there is anything that needs to be treated, it would also be treated. The good thing about this is everything from the time of screening to the procedure, colonoscopy, to the treatment is going to be free.
Really?
Yeah.
Because I know colonoscopy is very expensive.
Colonoscopy in Lagos now is, I think, is a minimum of 90,000.
I know that.
So anyone that comes and is tested and is positive, the colonoscopy will be done free.
Interesting.
And if there is any treatment that needs to be offered, it's also going to be free.
Before about 1, 2, 3 years ago, I didn't even used to hear of colon cancer. That's what we know it as layman. Until 1, 2, 3 people that I know succumbed to it. So earlier on, I halted you when we were talking about the symptoms. Some people say when you suddenly become constipated,
exactly,
that's a red flag.
Yeah.
You want to dwell more on the symptoms so that we can watch out?
Yes, the symptoms. Unfortunately, they're not that specific because constipation can be due to any other thing. Somebody that can have hemorrhoid, it can have anal fissure, and so on. Or somebody can even have constipation from not taking appropriate diet. So constipation is one of them. And we talk about, before even it gets to constipation, we talk about changing bowel habits. If you used to go to toilet every day, and then you see that you're skipping days in between. If you used to go to toilet and it's easy for you to bring out the stool, and then now you have to stay for so long, then you should, or sometimes too, it could be abdominal discomfort or abdominal pain. Some people can be advanced without taking notice until, the mass that should not even be felt, it becomes, you have a mass that you can feel, and then it can also present as bleeding through the anus or stool coming out, stool that is stained with blood. A lot of people use the toilets without really knowing what comes out.
Yeah.
They don't want to see. But it's important that you see, because I know of someone who never knew, and it was the wife that discovered that, oh, Daddy, your stool contains blood.
Now, this research and studies you want to carry out, what are you going to use it for? Is it to, apart from the fact that you're going to create the awareness, curtail the spread or the increase, what exactly is the study going to be used for?
Yes, the study, because we've done a pilot which shows that it's quite sensitive. There are several, there used to be another type of stool test that we used to screen colorectal cancer. But this particular one is like an immunohistochemical. I don't want to go into big terminologies, fecal immunohistochemical, something like, so let's just stop it like that. We call it FIT. So it's a little more sensitive, at least from the pilot study that has been carried out and has been published, have been presented at several scientific fora. So now we want to look at a larger population, looking at, like over 2,000 Nigerians, to see how sensitive this test will be. And if it is sensitive, because we don't even have the money, a lot of people don't even have the money to go and do colonoscopy.
Yes, definitely.
So if the government wants to have a program now, a screening program for colorectal cancer, and then says everybody should go and be doing colonoscopy, so there has to be a way to at least reduce those numbers and remove those that are not at risk from that group. So, and also those who don't have lesions, we call them lesions, abnormalities that look like colon cancer, so that the false positive or false negativity rate that we have with the occult blue stool test that we used to do, this one will be a better one. So we want to look at, how sensitive is it? It is. We also want to look at how convenient do the participants, how convenient do they find it, and see how many of them will be able to pull through to the end. So we'll be able to, then it can be recommended that this will be an appropriate or a better, a more sensitive method of screening to detect colorectal cancer earlier than if a test was not done.
Okay. Congratulations, because you're just going to be alleviating the suffering and the economic situation of a lot of people. Am I qualified to?
Yes, you are. If you are,
Because
if
I'm
you are,
wondering.
you are over, because we are recruiting 45 people that are 45 to 75 years,
Okay.
whether male or female.
Okay.
You don't have symptoms and signs of
And no family history.
and you don't have family history. Family history meaning along your parents or your brother.
siblings.
So we want people of low risk.
Okay, because you know that to a large extent we take our health for granted.
Yeah.
The people you have targeted are probably the low income. I don't know how you want to do it, that people who will say, there's nothing wrong with me, particularly the middle class and the elites, to be able to be convinced to take advantage of this program.
Yes, that's why we're using 2 centers. We know that the community, maybe those that are not able, because a lot of people run away from LUTH. They say, okay, because they treat COVID in LUTH and all that, so they don't want to come to LUTH. So we're going to be in Amushin too.
Okay.
And we're going to be doing it for 3 days, from the 15th of March to 17th of March.
Okay.
So we're going to be there for those 3 days.
And it's
from
free.
9 o'clock to 4 p.m.
PM.
And it's going to be free.
Okay.
So if they come, of course, there's tendency for people to come in large numbers. We already have a system in place to ensure that that we're not going that we're going to follow COVID protocol.
Exactly.
They will call in and we will book appointment for them, the time that they will come, and then when they come, the place where they will first of all sit and
observe the protocols.
Yes, observe the protocol. We determine whether they are eligible, and then we give them the kit, which they will take home to get when they pull the stool inside it and bring it back to us the following day, and then we test it. We look at it as how we're going to determine whether it's positive or negative. When it's negative, we ask you to go, but when it's positive, then we book for colonoscopy.
What's your counsel for anybody aspiring to even go into medical field or even becoming a pathologist?
I'll still encourage that our young people, those in secondary school there, you should still, don't be discouraged, because I know that this country, things will be all right, okay? So go into medicine is a very beneficial, fulfilling career. I have never regretted in a day that I chose this profession of being a doctor.
Driven by passion.
Yes, by passion. And then secondly, talking about my specialty, pathology. Pathology is the basis of diseases. And as we're talking of cancer now, I'll know how it starts, the processes, all the mechanism from the gene that is modified. Because all those risk factors that we're talking about, what do? They cause some changes in our genes. And that's why some people are more predisposed than others. And how do you become a pathologist? You first of all go to finish your school set. From there, you go to the university, 6 years minimum. And then you go to do residency training. And then when you become a doctor, you do housemanship, you do NYSC, and then you now say, okay, I want to be a pathologist. Then there is an exam that you will do. So you spend minimum of maybe 6 years
Thank you very much for coming.
Thank you.
We'll have you again. You are a
Thank you.
friend, and we'll always be tapping from that wealth of knowledge that you have been endowed with. That has been our program today, The Magnate. Rest assured that we will be enlightening you more on subsequent editions of this program. Thank you for watching. See you next time. Bye for now.